In the realm of pediatric care, a remarkable advancement exists. It's called Biphasic Cuirass ventilation, BCV. For young children whose delicate respiratory systems are still unfolding, this method offers a beacon of hope and healing. Imagine a child with lungs so tender, and they're in need of precise care. Now picture a wearable shell snugly fit around their chest, connecting to a sophisticated machine that becomes their guardian of breath. This BCV in action, a seamless dance of technology and compassion. Unlike older methods that sometimes felt impersonal or invasive, what BCV does is it cradles the child's respiratory rhythm with unmatched precision. The benefits ripple outwards with profound impact. You can't overlook the meticulous control BCV bestows upon breathing rates. For children, every inhalation and exhalation is a step towards growth, and BCV ensures this journey is steady and unburdened. What's more, this method harmonizes with the child's heartbeat, ensuring that it beats without strain, recognizing that a young heart is still growing and becoming stronger. Statistics paint a very compelling story. Studies show BCV's prowess, revealing that it enhances respiratory outcomes in children by an astounding 40% compared to traditional methods. And the tales from hospitals resonate with triumph, children finding solace in BCV, stabilizing their breathing patterns in over 85% of acute cases within a mere 24 hours. Biphasic Cuirass ventilation might be used in a lot of different medical scenarios where specific respiratory support is required. It could be acute respiratory failure, chronic obstructive pulmonary disease, COPD, neuromuscular disorders, post-operative care, respiratory diseases and infections, or maybe even weaning off of mechanical ventilation. Sometimes it could be cardiac complications, or in certain instances, even home-based care. It operates through a mechanical system, and that mechanical system actively controls the overall respiratory cycle. There's the cuirass, or the shell, and that process begins with the patient wearing the specialized upper body shell. It's reminiscent of body armor. There's a power unit and a pump. Attached to that cuirass is a power unit equipped with that pump, and the power unit serves as the control center for the ventilation process. It's responsible for generating the pressure changes needed to facilitate inhaling and exhaling. There's an active control phase. So unlike some passive ventilation methods, BCV is biphasic, meaning it actively controls both inhaling and exhaling. And during inhaling, the pump actively expands the cuirass, the vest, creating a negative pressure environment around the chest. This negative pressure effectively draws air into the lungs, mimicking the natural inhalation process, where the diaphragm descends and the chest volume increases. And then there's the expiratory phase. During exhalation, the pump contracts the cuirass, creating a positive pressure environment. This action helps expel air from the lungs, replicating the natural exhalation process where the diaphragm relaxes and the chest volume decreases. There's also an adjustable setting. That's where healthcare professionals can adjust various parameters like the breathing rate and tidal volume. It's all based on the individual patient's needs. And that customization right there ensures the ventilation is tailored to specific conditions or requirements of the patient. And then there's the controlled ratio, one of the significant mechanical features of BCV. It's the ability to control that inspiratory and expiratory ratio actively. This ratio defines the duration of inhalation relative to exhalation, and by adjusting this ratio, BCV offers flexibility in managing ventilation and can adapt to different respiratory patterns or conditions. Picture parents witnessing their child breathe easier, not within the clinical confines of a hospital, but within the familiar walls of their home. BCV's non-invasive nature becomes a silent promise, ensuring that children experience comfort rather than distress, turning moments of anxiety into chapters of relief. Biphasic Cuirass ventilation emerges not just as a medical marvel, but as a narrative of hope, resilience, and a brighter tomorrow. These are Interesting Things with JC.